Well, our big focus on the show today, understanding India's numbers as we've crossed the 2 million mark and are currently at over 22 lakh. Every day we're seeing an increase in over 60,000 cases. India is currently number 3 in the world, but our rate of increase is higher than that of the United States, that's the number 1, and Brazil, that's number 2. Well, to talk more about this, we're joined by Professor Bhramar Mukherjee, biostatistician, data scientist, professor and researcher from the University of Michigan's School of Public Health. Thank you so much for speaking to NDTV. And I do know that you've been watching India's story very, very closely. The numbers here, how do you see the situation now?
Yeah, so, this has been a long story for us. We have been modeling the pandemic in India since March. So India had 500 cases and 11 deaths at the time. So I feel like we have lived with this virus in India for the last 5 months. And it is actually disheartening to see that India reached the 2 million mark, because I expected that it is not going to be such an easy problem to contain things in India. But it's going for so long, and I can see from my family and friends and the public sentiment, everybody is getting anxious, worried, and the uncertainty. But I think there are some good news and some bad news. Of course, it has been going on and the curve has not turned the corner. That's the bad news. But the good news is that we understand a lot more about the virus. And some states which were initially exploding, they have come to containment. So that gives us hope that the same model can be replicated in other states as well.
All right, Professor, now Mumbai and Delhi both recently conducted the serological survey. Mumbai, it showed, had 16% of the people had antibodies. Delhi, 23% had developed antibodies. So how do you view that? And also given that so many of these people were asymptomatic cases?
Yes, so that's a great question, Gargi, and thank you for asking me that, because my team has been really working on estimating the number of asymptomatic cases, which seem to be a key missing part of the puzzle. And so for the Delhi study, if we really believe by July 10th, which was the period of study, June 27 to July 10, that there were 23% approximately population of Delhi infected, then we get an estimate of cases around 4.6 million in Delhi. And if you look at the data reported on July 10th, it was actually around 110,000. So that gives us an underreporting factor of the order of 30 to 40. So only 2.5% of Delhi's cases were detected and the rest were dormant. So there are some good news and bad news again for this observation, because we know that many people probably had it without knowing they had it. So they did not suffer and they did not have to seek medical care because they did not have severe symptoms. But on the other hand, they spread the disease. And so this is why this virus is hard to contain. Another thing which is I feel conflicted about is that we do not really know what antibody positive means at this point, whether how long, if this actually means that we have immunity, and if we have some level of protection, how long does it last? But again, the Delhi study and the Mumbai study actually gives us some hope, and also puts at some concern that we are not detecting most of the cases. I wish that there were more serological studies done all across India. We need to know more about the study details in terms of what percentage positive in age group, across different sexes, across different job types, different districts, to have more fundamental and granular idea about the data. But this is something that should be done across India to get a strong sense of what is the true extent of the transmission of this virus.
All right. And what do you feel about the death data we have available here in India? Do you feel it's reliable? Recently, there were researchers, over 200 of them, researchers and scientists, who actually wrote a letter asking that government agencies, release official and reliable death data to them for them to better understand the impact.
So that's another great question, because if we see a factor of underreporting of 30 to 40 for cases, can we be absolutely sure that the death numbers are accurate to the dot? Of course not. And we need to understand that how cause of death is being assigned all across India. Even without COVID, 1 out of 4, 1 out of 5 deaths in India are medically reported. And for COVID, there are many underlying comorbidities which can be also assigned as a cause of death, whereas it was triggered by the COVID infection. So the scientists are right, it would be always useful to get more accurate data so that we can calculate that compared to historical death values, how much increase has there been this year? And so we can have a more accurate estimation of the deaths. So the Sero survey gave us an underreporting factor for the cases, but we do not have such a benchmark for the death data, and that's what the scientists are asking for.
All right. And what is your view on the issue of reinfection? Because that's been something of a controversy in the sense many people, questioning whether you can indeed get reinfected, whether the antibodies last enough. It's not very clear yet about what the long-term protection is for someone who has been infected with coronavirus.
Yes, so the antibody response and we really need to understand the contrast, and this is probably the most important question the scientific community, one of the most important questions the scientific community is dealing with, is that what does it mean to detect the presence of the IgG antibody, and how does it relate to long-term immunity? So the antibody response could be an ephemeral response, but we really need to understand more, and there has been several hypotheses in terms of T cells and how long-term immunity can be monitored. But those assays to do the testing for the presence of those T cells is much, much more expensive, whereas this test is much more doable and practical. So I think there are lots of work going on there. But one thing I'd like to mention, that the large number of infections in Delhi, if the death data, say 4,000 deaths were reported in Delhi by July 10th, it was actually 3,300. And even if we believe that 1 out of 10 deaths were reported, then we also get an infection fatality rate low. But that does not really assure us that this is not a lethal disease, because we are going to get a lot of cases if a large percent of India gets affected. Even if we believe the death data, if it's 0.07 to 0.08%, then our calculations show that if 50% of India, which is 1.38 billion people, then we are going to get about 500,000 deaths. And each life is very precious. So we should not really talk about this as statistics, because these are preventable deaths and these are loved ones, and each life counts.
Right, absolutely. And, with the cases now seeming to settle somewhat in Delhi and Mumbai, we should keep our fingers crossed and not speak too soon. But what are we going to be seeing as cases? Now we're seeing cases surging in South India, cases are increasing in small towns. Is this how it's going to be, that we don't actually see a national peak just yet, but we do see, peaks or cases steadying in certain parts and increasing in other parts?
Yes, so even in May, we actually wrote a paper that was actually 2 months ago, that we said that the national data is masking the state level trends, and we expect a cascade of peaks going through the nation, various small heights, high heights, but peaks going through the nation in the next couple of months. And this is exactly what we expected, that some states will subside and then some states will come to boil. And as a result, it would be very hard to decouple these changes and look at the national peak, which may not show any turning the corner because it does not capture each of the individual state behaviors. And so right now, what we see that the first million of cases in India were coming from Delhi, Maharashtra, Mumbai, particularly, and Tamil Nadu. And now we see Andhra Pradesh coming up, Karnataka coming up, Uttar Pradesh coming up, as well as Bihar, Orissa, West Bengal, Jharkhand, the eastern states also showing rapid acceleration. So I think that there will be a cascade of waves going through the country, and we just have to, wait it out and see how things unfold and take the best precautions that we can to make sure that it does not explode. We all do our personal work in order to mitigate the transmission of the virus.
All right, Professor Mukherjee, thank you so much for speaking to us here at NDTV. Well, we were talking about India numbers there with Professor Mukherjee, and it's still far too early to be certain, but there are certain trends that are emerging that suggest that perhaps the COVID situation in India could be improving marginally. The percentage increase every day in new cases is now hovering at around 3% or so. There you can see the numbers there, and this is down from the alarming 4% that was just 2 weeks ago. So even as overall the cases are increasing, this percentage of increase of cases has come down from 4% to now 3%. However, there is little doubt that this current rate of increase of 3% daily is still far too high. It's much higher than what we've seen in global numbers. And there you can see how it compares to other and we'll just show you how yes, that's how it compares to other countries. In fact, India's daily growth rate at 3% is twice that of Brazil and almost 3 times higher than that of the United States, which is, of course, the leading country in terms of COVID cases. Perhaps the most heartening change is the slight but perceptible drop in the positivity rate. So let's just take a look at that positivity rate percentage, the number of people, that's the number of people who test positive out of every 100 tests. And while it is still far too high at 10%, this is, however, much better than the earlier rising trend 2 weeks ago when it hit 12%. So 10% is still extremely high and needs to come down much further with a lot more testing. There is no room for complacency. In fact, the positivity rate in most other nations is much lower than ours. So while ours has come down, it's still very high. Now, another worrying news that is emerging, the death of doctors who are the frontline COVID warriors. A total of 196 doctors in the country, a majority of them being general practitioners, have died due to COVID so far. That's what the Indian Medical Association has said, requesting the Prime Minister to give urgent attention to this issue. In a letter to the Prime Minister, the IMA requested him to ensure adequate care for doctors and their families who are a special risk group and extend the state-sponsored medical and life insurance facilities to doctors in all the sectors. They've also said there's disturbing reports about doctors and their families not being able to get beds in hospitals. Well, to talk more about this issue, we are joined by Dr. Rajan Sharma, the President of the Indian Medical Association. Thank you so much for speaking to NDTV. Tell us, Doctor, what is it that you've now asked from the Prime Minister? If you could just detail it for us. And the fact that so many doctors are dying due to COVID is very concerning.
As I am talking to you, we have lost 6 again. On 9th of August, we had 208 deaths. And today, we are now almost 215. The reports are just pouring in. Realizing this need, the first thing we did was to issue a red alert to our own community. Because somewhere down the line, there are some amount of things which are happening. Maybe the load is not being realized. You have to identify high exposure. So, bringing to the Prime Minister's notice was that losing 208 of them means that COVID is not sparing government or private sector. So even the benefit of social benefit should be extended to the private sector also. And also, we needed to revisit our strategies, maybe even PPE protocols, PPE qualities, so that the doctors who can actually be a game changer to save lives can be saved.
All right. And Doctor, what more would you like done to protect doctors to ensure they don't, die from coronavirus? So what steps do you think need to be taken? Also, what is it that the IMA is doing to help?
No, we are actually issuing a daily advisory. Now, I'm sharing it with you from tomorrow onwards. We are issuing a daily SMS alert to our entire community with the number of doctors, telephone numbers which we have. And also, one must realize people should not hide their status from a doctor and wearing a mask, because later realizing a doctor who is exposed in the OPD, when he goes back home, he's even infecting his wife. I have scores of incidents where we have lost the husband and the wife is still in the COVID quarantine because she is in the hospital. And complication rates are rising. So the purpose is, it is not a question of blame game. It is a question of working for the health benefit of the entire country together as a team, having an inclusive approach. And that is why the letter had been written to the Prime Minister. I have been briefing the Health Ministry on this on various times. But with this, we definitely still want to put our heads together and work out why. And we already have a policy document ready. I think by evening it should be ready. An advisory for the doctors. We have been issuing the advisories regularly, and if you want, I can share it with the team.
All right, Dr. Rajan Sharma, thank you so much for speaking to NDTV on this very, very concerning issue of doctors dying from coronavirus. A lot more clearly needs to be done. Welcome back. Well, it's time now for our Boom Myth Buster, and today it's about how a murder convict gave a fake, the story about how a murder convict gave fake COVID positive reports to his patients to steal their kidneys. This story is absolutely false. In fact, it pertains to 2004. Take a look.
So who is Devinder Sharma? Sharma is a former Ayurvedic practitioner who was involved in a kidney racket, and he himself confessed to killing more than 100 people. But all of this happened way back between 1994 and 2004, long before COVID-19 came into our lives. He spent 16 years in prison and gets out on parole for good behavior in January 2020. He then jumps parole and then gets caught again by Delhi police on July 29th. Now, we reached out to the DCP of Delhi Police Crime Branch who led his arrest, and they confirmed to us that ever since Sharma left parole, he was not involved in any fresh murders, nor was he involved in any COVID-19 related scam. So all these messages claiming that Sharma got healthy people admitted by giving them false COVID-19 reports to harvest their kidneys, they're all false.
All right, well, time now for our viewer question segment, and we're joined by Dr. Rajesh Chawla, pulmonologist in the Indraprastha Apollo Hospital. Thank you so much, doctor, for taking out time for us here on the show. Well, let's pull up the first viewer question that we got. This is Sehaj.
Hello, my name is Sehaj, and my question is that as we all know that corona cases are on a surge all around the world, and the hospitals are fully loaded with the patients. So how can the patients who are having mild symptoms or are asymptomatic can treat themselves effectively while being at home?
All right, doctor.
You know, basically hospital has limited number of beds. And, you know, after we realized in Delhi, you know, the chief minister allowed the patient to be treated at home, you've seen the control has been better. You know, a mild patient does not require much of the treatment. He just requires observation, which can be done even if patient is at home. So if you observe him, if he does not get a warning sign, the treatment of a mild disease is very little, or just a symptomatic treatment. He does not require any special treatment which requires hospital. He doesn't require oxygen or any of these other supportive systems. He just requires monitoring, which can be done by an oximeter. You must have seen an oximeter. You apply to the finger and you can see the oxygen. If it remains above 94, then the person can be easily at home. So, and he has to be isolated so that he doesn't spread the infections to others. So if a person can be in the home, he can get a home food, he does not have the feeling of isolation, why not treat these mild patients? And when they get a warning signs like any chest pain, any breathlessness, any drop in oxygen saturation below 94, they can be rushed to the hospital. So the mild patient can be definitely treated at home.
All right, well, that was very helpful there, doctor. We have another viewer question sent to us. Bindu, let's play out that question.
Hello, my name is Bindu. My question is, what is the most common mode of transmission of coronavirus?
All right, doctor, that's a very interesting question because, you know, there's been so much about surface transmission, you know, air transmission, etc. So I think this is a question everybody has.
You know, the major route of transmission is still the droplet infection. That is why people who are wearing masks most of the times, they do not get this infection. And if it was airborne, lot of families, lot of people would have got infected because the airborne, it would have stayed in the environment for a long time. You know, the other thing very important about virus is it requires living cells to survive. So it cannot survive in the air for a long time. So airborne cannot be a major source of the infection. So it has not been proven anywhere, although you must have seen videos and other things. But as of today, neither from surfaces because they have cultured from the surfaces also, and they found not much of the virus they could isolate from the surfaces after a few hours. So major source of infection remains the droplet infection, and maybe a little bit from surfaces for some time.
All right, so maintain that distance and wear your masks. Thank you so much, Dr. Chawla, for speaking to us.